Thanks again for taking time to chat today, Dr. C. Well, what can you tell us about the latest statistics coming out of San Antonio and Texas?
Well, as feared, things are getting worse. We're behind the curve in many ways, but we're bracing ourselves for what's probably coming. In Texas, now our cases are up to over 1,700, so 1,731 cases as of today, confirmed, and 23 deaths, unfortunately. And our own little bubble where San Antonio is of Bexar County, that's San Antonio and the surrounding area, we have 113 cases and 5 deaths. So all the precautions in terms of waiting for the crush, as it were, all the precautions are still very much being enforced and increased. Preservation of all equipment possible, personal protective equipment for our frontline healthcare workers. All elective cases are cancelled. We're not actually performing any breast reconstruction now, really at all. The cases we're doing are only for pretty much life-saving situations, chest wall coverage, very, very few, so you can count them on one hand, actually. In terms of overall breast cancer care, several more guidelines have come out. Really, what breast cancer patients need to know now is that your treatment will be individualized for you and your cancer, but the priority is to really keep you out of the hospital by all means possible. So anyone who has a diagnosis where all options are on the table ordinarily, unfortunately, you may be asked to, or the recommendation may be hormone therapy, just to basically try and keep you covered and control the cancer for as long as possible before taking you to surgery. There are some patients where that'll be a very, very reasonable approach and it won't impact the outcome. There are other patients that will still need surgery, and that's why it has to be a case-by-case basis with the physicians and the patient using judgment and the lay of the land where you are geographically, because everywhere is going through exactly the same situation. But even if things aren't dire where you are right now, there is a good chance that they're going to get far worse. So I do want patients to remember and to view things using one very important perspective. This is not just about preserving resources and protective equipment and everything else, and ventilators, ICU beds. Of course, that's of utmost importance in terms of considering what your doctor is going to be recommending. But in terms of you personally, the patient with a breast cancer diagnosis, please remember that COVID-19 is a virus that impacts primarily your lungs. You do not want to be in a situation where you go into surgery that in retrospect you could have delayed, only to be exposed to a virus that you otherwise could have avoided because you were in a hospital. We still don't know what the overall rates are. We don't know who's diagnosed, who's an asymptomatic carrier. We have no clue. So it is very possible right now that going in for a surgery will expose you to increased risk of getting the virus, and you could end up with a major complication from surgery The worst of which is not being able to breathe, needing a ventilator. And if you develop those kind of severe symptoms, then your chances of death go through the roof. So I can only imagine what it's like having a recent diagnosis of breast cancer, being told, and now having your options really steered by something else that's beyond your control. But please remember, this is also looking out for your best interests in terms of the immediate risk and minimizing your risk. So, and I also appreciate it must be extremely painful to have a plan and then all of a sudden it's pulled away from under your feet like a rug. Please know that that's not lost on any of us. Um, so try to look at this as decreasing your risk of immediate badness. Okay. We also know that by the time people are diagnosed, they've had their cancers for a long time, and so most of the time, uh, even not during a pandemic, but during regular times, there's often a long delay between you actually developing the cancer and then it even being diagnosed, picked up, and a treatment plan being formulated. So, um, and we know that in most situations, it's not going to impact your outcome and prognosis. So I'm not trying to belittle this in any way. I'm just trying to maybe bring a perspective that perhaps not everyone is considering. Um, in terms of PRMA, in the office, we've gone everything that can be taken care of without bringing the patient into the office physically. All of those visits are being converted to telehealth, either Skype or FaceTime, or whatever the patient wants and whatever they're used to using and comfortable with. There are still, unfortunately, going to be a very small number of people that need to be evaluated if there's a concern over an infection or something like that. But me personally, for my patients, if there's any way of me avoiding bringing you in, I will do that. So it's the safest thing. Remember, breast cancer patients are at increased risk of very severe disease if they contract the virus. So if I can minimize risk in any way for my patients, that's exactly what I'm going to be pushing for. So for those who may not be familiar with Skype or FaceTime, now's a really good time to give it a whirl. Okay, and we'll be patient, obviously, and help you guys get online and all the rest of it. So now's a really good time to learn telehealth. So it's certainly not going away.
Yeah.
So,
this
yeah,
doesn't change healthcare as we know it.
Yeah, and to be honest, telehealth should have been covered before.
Yeah.
There's so many people. Forget coronavirus for a sec, if possible, right? Before this hit, there are a ton of people that didn't have access or easy access. That telehealth really could have been very, very useful in improving patient access to pretty much any specialty.
Absolutely.
So unfortunately, it's been very slow in being recognized and being covered by insurance plans. So at least now it's covered by most insurance plans because of this crisis. So hopefully that will stay once we're through all this. And be one little silver lining in terms of positive change from all this horrendous stuff going on right now.
Absolutely. All right. Well, thanks for taking some time to update us on the situation, and I'm sure we will be chatting again sooner than later.
I bet we will.
All right. Thanks.
Thanks a lot.